everybody. Now, we'll move a bit closer to home. Back to school season is not limited to children. The next generation of doctors is headed to med school, and their curriculum focuses on health equity as much as it does on healing. Our Aziza Schuler joins us live. Good morning to you, Aziza.
Good morning, Melvin. Good morning, Giselle. This week, there are 175 students beginning their first year of medical school here at UCLA. And like you said, unlike their predecessors, their first classes that they'll be taking will not be focusing on physician-patient relationships, but the social determinants and inclusivity that goes into health and medicine.
The blessings of his late grandmother, who we see in these photos, are what Alejandro Quiñones Baltazar truly believe helped him through his undergrad years at UC Riverside.
She came here to the United States, immigrated from Mexico. So she's a really powerful woman that, I'm really appreciative and I hold close to my heart.
He's the first in his family to graduate college and is on the road to becoming the first doctor in the Quiñones Baltazar family as well. This fall, Alejandro begins medical school at UCLA on a full-ride scholarship from LA Care, a nonprofit organization that's been the only source for healthcare services for his family since he was a child.
We're a low-income family, and as a child, I was always really reflective, and so I saw my parents, struggle to receive quality health care. They would go to free clinics to receive their care, and for me, I was able to see that.
Not only in his household, but within the Linwood community. It's what he says drove him to follow his dream of a career in primary care.
There's definitely a lot of bias and stigma about certain communities, but I feel like that comes from not being part of those communities. So that's why it's so important to hear out and amplify their voices.
In his first year as a medical student, Alejandro is most excited about learning the public health components of medicine.
Our medical school curriculum, especially at UCLA, there's a public health interest in that, and there's a social justice interest, and that's incorporated into our curriculum now. So where you grew up, the community you grew up in, your income status, and all that affects your health.
Dr. Seidman, a pediatrician who spent his entire career serving communities across Los Angeles, says the next generation of doctors are learning more about social determinants than their predecessors did.
Today, medical students are learning more about the reality of these social drivers and the need to see patients as whole people and address not only their direct medical needs, but also their social needs.
Research from the National Institute of Health found that since the pandemic, more medical programs' curricula are including concepts of trauma-informed approaches and using inclusive language when dealing with historically marginalized communities.
Health is more than just science. And so as the future generation of physicians, we know it's so important to learn about that.
From Alejandro's perspective, the future of medicine is bright.
And Alejandro is one of 8 LA area students who were awarded full-ride scholarships to medical school from LA Care. 4 of those students are attending here at UCLA, and the other 4 are attending Charles Drew University.
That's good stuff. That's good stuff. So is there any update on how this change in the curriculum is affecting attendance to medical school, Aziza?
Well, the good news, Melvin, is that the COVID-19 pandemic really underscored the need for social determinants to be included in medical education. And there was actually an 18% jump in medical school applications last year. However, the American Medical Association reports that factors like the increasing U.S. population, as well as the expensive price tag of medical school and student loans, are some of the deterrents for some students to go into medical school, and continues to cause that shortage that we're seeing of doctors.
But let's just focus on the silver lining that we are seeing an uptick, and we need that uptick. So
good stuff.
That's good stuff. Thank you, Aziza. Equity matters. That's exactly right.
Yeah, access important too.